People wake up on a normal day and suddenly something happens that changes their lives completely.
Pediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and he's got an arterial bleed from his leg.
High-speed RTC moped into a wall.
Jesus Christ, what happened? You all right?
I love my wife.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break.
I think it's going to be one of those days.
A place where life,
Darling, what's for dinner?
love,
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Good morning, emergency department.
You all right, dudes?
Morning. All right. You okay, so? Yeah, man.
What hospital are we at again?
Tooting St George's.
Tooting St George's. St George's Hospital. Tooting St George's Hospital.
Hello. I'm just checking the oxygen on the trolley, yeah? Can't really sit down in the office. That's not my thing, you know? Thank you, yeah?
Anthony is one of 10 porters who work in A&E. Originally from Jamaica, he's been working at St George's for 4.5 years.
Never set out to be a porter, but the bottom line is I like people. Every time my shift is on, it's great, man.
Yeah, man, look money.
But, I mean, life is not perfect in A&E, you know? 'Cause people come at St. George's at the hospital, like, in a lot of pain and agony.
It's fine, okay? You'll be fine, all right? Things like this happen. It hasn't gone all the way through. The fact that it's blistering, all right? It just heals.
Patient can come in, things happen to them, and then leave in a couple of days or a week, and then better. So that's a good outcome.
Kiss. Give me a kiss. Give me another kiss.
It's not all the while everything end up on a sad note, you know? Life is a roller coaster, yeah.
Mr. Anthony,
Hello.
here's the porter. He's going to take you to X-ray.
Right,
All right.
You're welcome.
He's got a very good singing voice. If you ask him, I'm sure he'll sing you a tune.
Good.
Sometimes it make you think, you know? You have to appreciate now, this moment now, and try to live a life, you know, to the full.
Marvellously changed, isn't it? Oh, mate. Why does it need to be so loud? I ain't deaf. Must be.
Hello, George. Is Amy here?
At our trauma call, ETA 10 minutes.
Paramedics have been called to the scene of a high-speed bicycle crash involving a 70-year-old cyclist.
Fell off. Did they say at what speed or anything?
Approximately 30 miles per hour onto the left-hand side. Left side chest pain, left collarbone pain, elbow laceration.
Registrar Fahim will be leading the trauma call.
I graduated back in 2003. I actually graduated from St George's, and I realised that the emergency medicine was for me. I like the ups and downs. I like the adrenaline rush that you get at certain times. It's got that edge to it that other areas don't have.
The man was cycling with his son when the accident happened. His wife and daughter have been notified and are on their way to St George's.
I just remember thinking, I've just got to get up there and see my dad.
Wait, you have your primary survey? Hi guys, hi.
I can't remember my dad ever being in hospital, ever, growing up. In my eyes, Dad was just always this big, tall, strong dad, never really ill. I don't ever remember him ever having any sort of accident.
You give us handover?
Yep. This is Tony. Tony's 70 years old. He's arrived on a push bike, travelling approximately 25 to 30 miles an hour, where he was witnessed to stumble and fall, landing on his left side. On our arrival, he was very grey and clammy, complaining of left-sided chest pain, worse on inhalation. Got a nasty, deep laceration to his left elbow. You can actually see fatty tissue and bone, and also to his right hand.
Thanks guys.
Tony.
Yes. Abdomen is soft, tender. I'm just going to press on your pelvis. That's fine. Is that causing any pain? Just very gently. Any pain here? Here? Sorry. Here?
Okay.
Down here?
Yeah. So we might have a couple of rib fractures. We're going to get you something for pain, okay?
I knew from my brother he was having trouble breathing, so they were obviously concerned about was there any damage done to the chest internally.
So I'm Fahim, one of the doctors. So what we're going to do now, we're going to get you around to the CT scanner. As a doctor, you want to fix things. You want to make things better. You want to always strive to get the answer, make the diagnosis. And at times it can be difficult, and at times you don't know what's happening or what's going on, but you know something's not right.
Could we have reported to take a patient to scan, please?
It's always important to know the seriousness or the potential seriousness of what you're dealing with. So you have to be able to prioritise what needs to be done now, what needs urgent attention, where the patient needs to go. Let me disconnect him. Have you got oxygen underneath?
Yeah, man. Anything can happen, so you're more cautious because things that you see at work, you know? Before working in hospital, you take loads of risk, you know?
All right, we're going to go around to the scanner now, OK?
I got it. Working here definitely change you. It makes you more cautious.
Roberto! You're only little.
I know,
Little dinky. Tell me what happened.
I was playing football and I clashed my head with another guy's head.
Okay.
Someone came down and knocked on my door, and my dog, she's a very nervous dog, she's highly strung, and she dived at me and she bit me.
Okay. You raise your eyebrows, frown, smile, stick your tongue out, move your tongue from side to side, and then puff your cheeks out. Good, thank you very much. Alcohol?
I have a couple of glasses of Guinness a day, but my son said that's what's keeping me alive.
And roll.
70-year-old part-time DJ Tony is having difficulty breathing. He needs an urgent CT scan to discover any life-changing injuries following a high-speed bicycle crash. His wife Angie and daughter Jo have arrived to be with him.
Couldn't have a better dad. He's funny. He likes to talk. He's just lovely. We had a brilliant time growing up. Myself, my brother and my sister. He was always around, so we used to do lots of things just together. I remember weekends we'd go on family walks. It was never just a little walk, it was always a march. He doesn't do anything by halves.
Breathe in and hold your breath.
I think there's bits of gravel in the superficial parts of the wound.
He's done lots of things, Dad, with work. I mean, years and years ago, he was a fireman.
Breathe normally.
Well, his main thing he's renowned for is being a DJ, still at 70. He loves it.
He looks really good for 70, though. He's 78.
That's how you look, you know? When you live healthy, that's how you look.
All three of us used to help him with the discos and be his roadie when we were younger. And I just always remember just standing with him all night and chatting to him.
Good to go.
Knowing him, he probably still thinks he's about 26.
I got him. Yeah, I'm on.
I don't think he wants to get any older.
No.
Tony is being taken back to resus while doctors assess the results of his CT scan.
There's a huge swarm of bees this morning.
Where?
In London.
Huge swarm?
Yeah.
In London?
Yeah.
What, like, what's a swarm like? As in
Swarm?
millions?
Yeah.
Oh, is it?
A huge swarm of bees sends Londoners running for cover. The huge swarm sent shoppers running for cover at Topshop near Victoria Station this morning.
Just come from Mackenzie. Aye, what, girl? Yeah, man. Yeah, thank you.
Actually, I roasted some chicken yesterday, chicken thighs, like a batch of them. And I marinated them with tomato sauce, honey, and a little bit of mustard.
Oh, yum.
Really
And
good,
chicken, yeah.
really good.
Nice.
I thought the tomato sauce was just like a genius idea. I was like, I'm gonna stick some of that in there as well.
I use tomato puree in my stuff.
Oh, yeah, puree.
Puree.
That's nice, it's different.
Nice.
It's unusual.
Unusual.
It's unusual.
It's a multicultural society we live in, you know, and the environment that I'm working. Which bird do this?
Huh?
Which bird do that?
Oh, flamingo.
No, rooster. Yeah, bet you didn't know that, eh? Other people are not from Jamaica. They like how me speak. So you so move out of land and left me.
What?
You so move out of land and left me.
Your accent.
You so move out of London and leave me.
Ah, I get you. Yeah, maybe.
So long as you can understand me, and if you say, repeat our pardon, we try to slow it down, you know.
How's it going?
Well, I'm gonna look something to eat now, man. I'm hungry.
What are you gonna have?
I don't know. I just go. I don't know.
I like that I've worked here long enough now to understand you.
Oh, yeah, man.
I know. I know.
I guess I can't change who you are, you get me? Yeah, man. You can try.
"70-year-old Tony's scan results are being reviewed by doctors.
He's had a CT head to pelvis, yeah? The main issue is with the rib fractures. There's difficulty breathing. He's also got a laceration to his left elbow. He's got a laceration to his right thumb. But the orthopaedic reg is here, actually. Do you want to speak to the cardiothoracic? I've told him about this.
Hey, Tarashov.
You've got multiple rib fractures on the left side, And in the middle, your middle bone here, yeah, you've got a break there as well. On the left side, what's happened, the ribs punctured the lung, if you like. You've got a very small, what we call pneumothorax. But the main issue at the moment is making sure we get your wounds nice and clean.
Tony has a collapsed lung and will need orthopaedic specialists to assess significant lacerations to his elbow and wrist.
This is just so alien. I've never looked after your father in my life.
It was quite frightening because, you know, my dad, he doesn't make things up, he doesn't put on a show or anything, so I knew that when he was struggling, he really was struggling.
How's your pain, sir? You all right?
Still there in the chest.
Yeah? Do you want some more pain relief?
Where's the worst of the pain?
I'll get you some. In his chest, is it?
Chest. All right, now I'm just going to wash it out thoroughly, get out any of the bits of road that you brought with you.
What would you advise I say to my wife?
What about how you came to be here?
How about you just fell off your bike?
You could just tell her you fell off your bike.
He doesn't want me to do the race.
Oh, you've got a race?
Is that what you were doing? You were training for a race?
I'm training for the 100-miler.
100 miles?
Yeah, we're doing, with my son, we're doing it for kidney research.
Oh, very good.
But I know for his 70th, he was training to do the bike ride. So that, you know, that was something to celebrate his milestone, was he wanted to do the bike ride.
That's a bit of gravel out.
I do remember sort of thinking to myself, right, try not to look shocked when you walk around the corner and see him, because I didn't want him to see maybe my initial reaction.
It's fine.
Yeah.
Yeah, I want to leave it a bit open. Are you okay like that?
I don't. Fine.
I'll leave you to it.
OK, thank you.
Oh, I could have cried for him. I couldn't bear seeing him like that. Just couldn't bear it, because I've never seen him like that before. What hurts?
Chest. Oh, dear Angel. Sorry, sweetheart.
Well, you just got to give in to nature for the first time in your life.
Well, I think Mum thinks sometimes he just does too much, and that she wants to say to him, what she does say to him, you know, you're 70 now, you haven't got the body of a 40-year-old, or I think she just thinks he should slow down.
Probably keep him in because of his age.
Oh, that's it. Go on. Have a go with my age.
Unfortunate.
At your age?
At least you got to 70, though.
He just wants to just live life to the full and just keep going while he can. He still wants to carry on with the discos until he really physically can't do it anymore. Or no one wants to book him anymore.
I'm going to get you upstairs, OK?
OK, yeah, no problem. Onward, Christian soldiers.
Tony is being taken to a cardiothoracic ward where specialists will decide if he'll need surgery to repair his collapsed lung.
There's some fit doctors in here now.
There's no EastEnders on last night, was there?
No, do you know what? I know I live for EastEnders, but we had to put it on for now Monday or whatever, and then that's not on Friday. It's not even like there was like children in need on or something. We were in my EastEnders. Yeah, that depressed me, that did.
39-year-old Charlie has been off work for a week after breaking his arm falling off his scooter. He's come to A&E with his partner, Danny.
I work down at Gatwick Airport as a cabin crew for an airline. It never occurred to me ever that I'd be the sort of type to do that kind of job. So I just thought, well, I could give it a go and try it. And I got through the interview process, and I was quite shocked, really. So quite a few people.
Oh, you look like a tramp.
What?
You Too trampy.
Oh, that's why I want to get some painkillers in me, so then I can go back and have a bath.
It's not going to work like that, mate.
Smart again.
You don't...
I'm not staying in hospital. I feel fine.
You feel fine? You've been moaning for days and days and days.
That's because my shoulder aches. But I can get about. I'm not going to be lying in a hospital bed. And if it's another bed, there's all other people coughing in like that.
We do like long haul and short haul. The long haul places are mostly sort of holiday destinations, like the Caribbean, and then we do short haul as well. And I do like going somewhere where like in Jersey and Glasgow and Edinburgh, you can still use your sort of normal money. You can watch the telly. I can always watch EastEnders when I get there, and you just feel a little bit more like you've got your creature comforts.
You stayed in one night.
Oh, I did. Yeah. You're right. Yeah.
Then you had the operation, and then you decided to leave that day.
And they let me go the next day at like lunchtime.
He discharged himself.
Yeah.
They didn't let him go. They didn't want him to go, leave the ward, but he decided to leave the ward because he didn't want to stay there.
That's 2 times?
Yeah, it's twice he's done it.
Yeah.
And then happens again, now he's back again.
It was just the pain. I couldn't deal with the pain. The rest of me is fine. And I don't like to use up hospital beds if there's someone's really ill. You know what I mean?
All right, just take a seat.
Thank you. Cheers.
It's not good on your head when you're not at work. I hate morning telly. It just reminds you that you're not at work. And I enjoy my job and I can't wait to get back to it. I really genuinely like going to work.
That hand's so fat.
Huh?
Your hand's so fat.
Where? Your hand?
Yours.
Yeah.
You've got to have that x-rayed again.
I have?
Of course. You've had a break. They're going to come in and check you fell on it again. They're going to make sure it ain't broken. You moved the plate.
A 61-year-old woman is being rushed to St George's, suffering with a debilitating ear infection.
Start with her here.
I will do.
Junior Dr. Kian will be treating her.
Malignant otitis externa is a rare ear infection, and in the most severe cases, it can spread right through to the brain and can even kill people.
OK, let's get reception to come round and book her in.
Not as in I don't want to take you home, but I want to know that you're safe. I want to make sure that you're all right. And then I'll happily take you home. They've got to check your head.
Erin has been fighting the ear infection for several weeks. Her daughters Bella and Mason came with her in the ambulance after she collapsed at home.
Or paracetamol, constantly.
Hello. The infection that this lady had in her ear was really, really severe. The pain for her was so bad we had to give her intravenous morphine to try and get things under control.
Mum collapsed. She kind of went and was... It was... I mean, she was... Well, it wasn't even... It was... I don't know what it was.
Do you remember falling at all? No. OK. So it's very difficult to know exactly what causes convulsions like that. We do know your blood pressure has been quite low. I think you might have been a little bit dehydrated.
Yeah, I never should have Googled the malignant OE. Never Googled that. It's a virus that eats away at your bone and your flesh. It starts from swimmer's ear, believe it or not. It sounds harmless, doesn't it? But when it gets to that stage, if anything you read, all the doctors say, it's the hardest thing to control for pain. It is agony.
If you can, try and keep your head still for me. Let me have a look and see what you've had so far in the way of painkillers and things.
Just before she collapsed, she was apologising to me. And she was like, I'm really sorry, I don't think. She goes, I don't think I can do this. I'm in so much pain, I don't think I can keep doing it.
It's important to make sure that the fall today, which may have included her hitting her head, hasn't resulted in a bleed from that. We can do a CT scan of the brain. We're also going to take some X-rays.
Thank you.
No problem. Yeah, fine.
Erin's brain scan will show if her ear infection has spread and if she suffered any other injuries when she collapsed and hit her head.
Want to go out there? It's all right, isn't it?
Other members of Erin's family have arrived at St George's.
She's just in pain, just constant pain. I was asleep, and then I heard my mum collapse in the bathroom. Mum was on the floor. She went, and then she was twitching in my arms, right?
Yeah.
I'm talking about, like, I thought she died. Well, as far as I'm concerned, she was gone. She was gone, Sally. Right? I just kept yelling her name, and then I was begging her. I was going, Mum, I'll fix everything, and please come back. I'll make sure that you're in no more pain. And then she did. After a bit, she came back. I was like, oh. But then I felt really guilty because I thought I brought her back to all that pain.
Rock, paper, scissors. 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 You know I beat you every time. You didn't beat me every time. Are you dumb? It's unfair.
"61-year-old Erin has been battling a severe ear infection for several weeks. Doctors need a CT scan to discover if this was the reason she collapsed at home and if the fall has caused any damage to her brain.
I never gone far from my mum. I've always moved out, gone back, moved out, gone back. Just spent loads of times with her.
Okay. Let me slide the bed right up beside to make it as easy as possible. And if you're having trouble, then we can move you across.
I couldn't have had a better mother. No way. She was just loving, always there. I was really lucky. That's my favourite memories, actually, of my childhood, was my mum. We used to live in a maisonette, and she'd put music on and be dancing around and singing. She'd love music, always singing My Cherie Amour over and over again. And then we'd get all the penny jars out, because we didn't have much money then, and we'd count them all up and go down to the Chinese and get special fried rice, take away and bring it back, which was quite cute. That's my fondest times, I think. The blondes. My Uncle Sean calls her that, because she was always had the big blonde curly hair and then was always jigging around. She's the sort of person that everyone would want to have at the party. She's so pretty, so like Bonnie with the blonde hair and like small, skinny, flat stomach. We used to go to, in Croydon, it used to be, what was it, the Blue Orchid. She's just lively. She loved dancing, loves dancing. We went to Blackpool for my 16th. And she got offered a job by the club owner to go dancing there, which was quite funny. I was like, Mum can't take you anywhere. I didn't realise how close I was with my mum until she got ill.
Erin must wait for the results of her scan before doctors can decide on a course of treatment.
Charlie? I'm coming. Give me a bit of chance.
39-year-old cabin crew worker Charlie has come to A&E with partner Danny. He had an operation on his arm 3 days ago following a scooter accident.
Hi.
Good afternoon, my name is Mario. Have a seat on the chair. So, tell me what happened.
I had an accident come off my scooter on Monday this week.
What happened?
I turned my wheel, there wasn't anyone else involved. I turned my wheel and it clipped the curb, and that's why I come off and I hit like a lamppost.
And what were you doing? You're driving a
scooter.
Scooter. Did you hurt your wrist or did you
hurt
your
Explain what's happened, because you're not getting the full story. Right, let me explain to you.
We just argue loads and bicker at each other. It's like, it's just ongoing, and like, we're used to it now, to be honest. It's him mainly, I have to say. And I'm usually right I mean, genuinely.
He's been a week he had this accident. He's had an operation on it. He's been at home letting it recover. He's had it in a cast, but he took the cast off himself. He fell today on it. He shouldn't even be out of the cast. He took it out of the cast.
Can I explain?
He fell today and he's fallen on it and he's in a lot of pain.
Just do it slowly.
I know, but you're explaining all above, and I just want to explain exactly how it felt as well from the patient's point of view, not just what you're speaking at.
Most of the time, we just like go around each other's and just sit, chill, watch telly. Yeah, we are a bit similar. And we know what buttons to push. We get on too well, sort of.
What operation did you have?
That operation.
Is that the plate put in it?
Plate put in it.
Last Monday.
But like today, I'm sure it's all fine. But I'm in agony. I can't even be walking.
He was telling me that you had.
I've been saying with him.
He's taken it out himself. He took it off himself.
I can't bear the task. It itches. Can I get one of them? Do you know what, it'd be easy if you... Can I just have a sit on my own? Is that okay?
Come on. Maybe he's just trying to explain.
Yeah, I'll pick up with you 5 days.
Oh, yeah, we're tight, yeah. He's on my staff travel list. We allow 2 people on it, so he's been with me on a few places, and yeah, he's really enjoyed it. Been Jamaica, Barbados. We did a cliff jump in Jamaica, actually. That's pretty cool. Had to have a few margaritas first, so...
Can I have a look now?
Yeah.
Yeah, sure. So what job do you do again?
Work for...
Cabin crew.
Cabin crew?
Yeah.
So you work as a cabin crew. So you tell us when you're riding the plane, you have to put the seatbelt on, and you get angry when we remove the seatbelt, isn't it? You know, I'm just talking from your point of view, isn't it? You got your own rules when you're riding the plane. We got our own rules when you go on treatment as well. So I can tell you off now, isn't it?
Exactly. The tables are turned.
You see?
Yeah.
That's the importance of following instructions. I wish I could do this to you.
You can.
No, not. I want you to go for X-ray again.
Yeah.
When you come back, go straight to this cubicle.
Lovely.
Okay, thank you.
Thank you.
As sure as the sun will shine, I'm gonna get my share. What's mine? I say the order they come, order they fall, running on. When I was growing up, I used to say my mom working and singing at the same time. And I always ask her why she do that. Wonderful world, beautiful people. Let me help my friend. She just said, well, it make the time go faster. No matter where you come from, as long as you're a black, you're an African. You know, if your workload a bit heavy and you keep singing, it just mellow things, you know? Stick by me, and I stick by you. I love you, darling, and that's no lie. Oh, 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 oh. Yeah, man. Stick by me. My mom teach me almost everything I know. You never forget the teachings that we grew up on, you know? Yeah, my mom and role model, man. Great lady, you know? Yeah. My mom might live thousands of miles away from me. She's in Canada. When I speak to her, I always feel good. You know, because every end of the conversation me and my mom have, it always, I love you. And she said, I love you too, you know? And that's good.
So I got it. I'm going to hold it.
Doctors are waiting for scan results of Erin's brain to discover if her ear infection caused her collapse and whether she suffered any damage to her head in the fall.
What you've got to do when you've got a patient like this is you've got to think, what are the things that you can do immediately that will make them a bit better and certainly won't do any harm before you've got the full information.
We just have to keep giving it, can't give it in a one great big dose. Let's get this into you. And it's mixed with some anti-sickness as well. So it's the anti-sickness and the Oromorph.
She's just been so much pain. I went to home last night and Nordy's just shaking with the pain.
It is pain.
And then when she collapsed this morning.
It is hard. You've had a huge whack of morphine, which just can make people feel terrible. Drop your blood pressure, make you feel sick, which kind of counteracts the pain relief.
15 years ago, Erin was diagnosed and treated for breast cancer. Although given the all clear, she's suffered significant complications ever since.
The reason Mum's got the heart failure as well as one devil for another, because she had cancer, the mastectomy.
1999 was diagnosed with the cancer and then started having the treatment about the same time my daughter was born. Yeah, because there's photos of Tamsin when she's a baby. My mum's got no hair, bless her. My mum was still throwing her around on her leg, lifting her up in the air, and my mum was so optimistic, and I love that. And then for the chemotherapy to damage her heart and give her a heart failure, and then she just had a stroke right in front of me. It was horrible in Tamsin.
Yeah, one minute I think, you know, oh, it's working.
Yeah.
And then, you know.
And then the sickness kicks in and you're more worried about that. Do you want me to turn this light down a bit?
Yeah, please.
Thank you. Oh, that's nice. Hey, look at that.
She's been having these multiple episodes of collapse. She's got a low blood pressure on an ongoing basis. So on the basis of that and the fact that she's on rivaroxaban following one of her strokes, I felt it was worth scanning her head.
Yes.
You know, of the previous collapses, 2 of them have turned out to be strokes.
For me personally, I've been on the other side. I've been that relative in hospital with loved ones who've been unwell, and I know how scary it can be, how helpless you can feel when you're waiting for doctors and you're waiting for nurses and you don't know what's going on and you're wondering what the answers might be. I think in some ways it's scarier for relatives than it is for patients.
You watch someone you love every single day sick. You know, it's really hard. She can't move about as much. She can't really go anywhere unaided. It's just different because it's taking something away from them, which is, it takes something away from you, you know. I suppose it's like slowly losing your mum kind of thing. I'd never want Tamsin to go through what I've gone through with my mum. No way. I wouldn't. And I don't mean that it's taking me away from my mum. I don't at all, but it's heartbreaking. Watching someone you love suffer and you can't.
Just there. Yeah.
Hey, cast.
Airline worker Charlie broke his arm in a scooter crash a week ago and is back in hospital after removing his own cast.
This is your X-ray today.
Okay.
Today's
X-rays. That's your fracture. First fracture, second fracture. Yeah. That's on the elbow.
Yeah.
That is the shoulder X-ray. And you get a fracture on the head of the humerus, which is this. If you look, that because maybe that you're pushing, that's why it's looking a little bit odd.
It's bigger, doesn't it? Yeah.
And that's one of the reasons why you have a cast that is quite heavy.
Yeah.
Right.
To give it a chance for this to heal. What I'm going to do, put the cast on.
Yeah.
If you keep on removing the cast, and that's the bones will not
It's not
heal.
going to heal.
No.
It will heal, but in a very odd way.
Yeah.
That means you're going to have difficulty in doing your job.
Yeah, don't want that, mate.
Just been a proper bad year, this. My nan's passed away this year, and my dad's got over having a cancer, and he's got over it and he's all better now. So all these things, and this accident, yeah, it's not been good.
Oh, that's what I was going to... Just them staples, when do they come out?
20 days really. Let me just get the dressing first for that.
When I discovered there was all those
staples,
I was like,
you didn't
what?
know, yeah.
I didn't even know. I was like, what are they?
Just felt it.
Do you know what I thought it was? I thought they were the staples that come off my coat that I was wearing during my ride, and they just got embedded in my arm, and they like not bothered taking them out.
No, that's one of the new things here. Staples is better than suturing, really.
Is it? And and does it hurt to take them out?
No.
Everyone goes through these like little periods in their life, you know, where it's a challenge, and I sort of, in a way, I sort of relish it, because I think that's what life's about, is being able to sort of deal with these situations, you know, and hopefully come out the other side and think that, yeah, I've made it through that.
You're lucky you have somebody who cares for you.
Yeah, exactly. It's nice to have that. Not everyone gets it, you know. That's true. Not everyone has love and care.
People don't say that. Oh. He's there for the like important stuff, you know, so I could rely on him for anything that's really important. Yeah, he was great.
Right.
So.
How do you find that? Sorry.
I'll just be happiest, hopefully, maybe next year when this is all over, and I could get back to my normal self, get back into my normal routine, then back at work, then I'll be well happy.
All right, let it go. See how it goes.
I think it feels all right, you know.
Does it feel all right?
Yeah.
Right?
Yeah, that's better.
Good. Hopefully we don't see each other tomorrow.
No,
You remove the cross again.
Keep them away now.
All right. Okay, keep your fracture clinic appointment.
Yeah. All right, we'll go to the front. This way. Thank you.
Thank you.
So lots of good news. So I've had a look at the different scans. There's nothing out of the ordinary on the head scan. So you've not had any serious head injuries from the fall.
That's good.
And the scan has given us another look at the ears as well. And while there's still some fluid left on the left-hand side, there's lots of air in there, and it all looks like it's heading in the right direction.
That's good.
Okay.
With no obvious cause for her collapse, Erin will be given a further dose of strong antibiotics to continue to treat her infection, and will be taken to a ward to be monitored.
I don't know anyone as strong as my mum who could go through all of those illness, one after the other, and still be here, and she's still smiling at you, and yeah, it's pretty amazing.
I like seeing you in pain, it upsets me. I just feel frustrated because it's good news, all of that stuff. It's brilliant news, but I just feel frustrated. I know what happened with my mum. Bless you.
What my mum's taught me is family is really important, and you stick by each other through thick and thin. You're always there. That's it. You love each other. You do the best you can. That's all you have to do. Just as long as you love someone and you do the best you can, that's it.
It's okay. I'll push it. Take care. Bye-bye.
Stick by me, and I stick by you. Ooh, ooh. Yeah, man.
I I think just because you're getting older, it doesn't mean to say that you can't do things. Nowadays, there's so much to be done. If it's there and you fancy doing it, go and do it.
I've had some bad turbulence where I've had people screaming and stuff, which is great. I love it. I've gone flying up in the air, but I don't know, I quite like that. Yeah, it just adds a little bit of something to your day, you know.
My children sort of keep me going, you know. My girls and my granddaughter, you know. We're all sort of close and we, you know, we love each other so much, you know what I mean? That's what keeps me going, really.